I opened this birth center to give women choices. And so if Charleston Birth Place wasn't here, it would take away a big choice for them. The birth center fills a gap between the home birth midwives and the hospital and the physician-based practices. And many times we will have families that come here, they view us as a in-between. That's a safe option.
The Charleston Birth Place is such a unique facility. We are the only full-scope midwifery practice in the Low Country. We obviously are the only place that offers water births, and we are the only low-risk, out-of-hospital birth facility beyond home births. We're kind of that happy medium between a home birth and a hospital, and offer women, an experience that they're not going to get in the hospital setting.
There are options for everything under the sun, but not a whole lot of options for birth. And I love that the birth center gives you another option to have a baby. A lot of people think, oh, I'm pregnant, I need to go to the hospital, and that's just that. And we do a really good job of informing our patients that no, actually, you do get to decide what you want. You do get to say yes to this, you do get to say no to that, you do get to ask as many questions as you want.
Hospitals are great to deliver in when they're necessary, but when it comes to birth, not all of it is an emergency. It's something that's a very natural process, and I think that midwives are really the core of what should happen when it comes to birth, and we really need more midwives in the Charleston area, but thankfully that's what Charleston Birth Place is all about, and so we get to help our community.
It's so nice to be able to have the option for women who want this option in their GYN and labor and pregnancy care, for them to have this low-risk, personalized, individual option. And midwives actually have been shown to improve birth outcomes and pregnancy outcomes in a lot of women. I think everywhere needs a place like Charleston Birth Place, a birth center and midwives to take care of low-risk moms.
I feel like birth centers have a very unique model of care that's very different from a hospital birth. I think most people understand that. But they might not understand how different we are from home birth. A birth center, especially one as large as ours, can accommodate a lot more people. We do have a team approach, so you get to meet more than one midwife. And because we're static, we're not moving, our transfer arrangements with the physicians in the hospital is also static. So we know what hospital we're going to. We've been there before. We've worked with these people. So it makes a very smooth transfer in. And then our midwives have privileges at MUSC. So should we need to go to MUSC, they go with them. And it makes it a much easier transfer. So for that just in case emergency type situation, it's just a little bit easier and smoother.